All right, we're here today with Nate Graven at Graven Sports Therapy. On the table you have Eric Manning, ultra runner, works for Smith Athletes, the head of the Hummer ultra running group. Today we're going to go over just some general guidelines for getting performance body work, why you should get it on a regular basis. And we'll go ahead and just let kind of Nate talk, and then I can ask questions, and of course Eric can always jump in where necessary. So Nate, why is it important to have some sort of performance body work, whether it be from you or another therapist in the area?
Well, so common with athletes, just in general, especially endurance athletes. You guys are doing a lot of repetitive actions and breaking things down. I'm building back up with your training, but tissues get restrictive and joints get loaded up, and sometimes even with really good flexibility programs and stretching on your own, you cannot target deeper structures. You can't organize at a level that sometimes can stop patterns of disuse or overuse or wearing tissues down. And bodywork can manipulate to affect other tissues. We can get at a deep level. We can organize muscle groups that tend to get beat up and overused. So with runners, so common to have, compartment strain, calf issues, IT band issues, tracking issues of the ankle, any of the tendinitis, Achilles, plantar. So this can be a tool, let alone to treat those when you're having trouble with them, but ideally to keep tissues moving as a preventative. And then if you keep that tissue just more supple through that consistent organization, you're going to have less likelihood of restrictions and breakdown. So it can be a really good tool, and it can be on a performance tool. If you mechanically are more sound, there's more economy of muscle engagement, and that means you're going to have a quicker leg turnover, you're going to have more joint play, and just ideally have better performance.
Along that lines, when you have more efficient movement, that means you can train more consistently at a higher level. So you need to think of it that way. It's just another tool to have in your bag for enhancing your performance.
Well, big time, because that's so many times you're going to do just maintenance workouts, but you'll at different times have breakthrough workouts where you're going to do overloading and training. Well, this can be a tool to help you recover, so you actually don't miss training opportunities, and maybe get even more from it. So it truly can help on the performance side.
Right. So talk a little bit about what to expect the first time somebody comes and sees you, because like myself and Eric, we're kind of veterans of your body work. We're big believers of it, and we definitely sing your praises to everybody. But some people are apprehensive to come in. So what would somebody expect, or what would be like a first experience for somebody?
Well, so this is it's deeper intention. I mean, it is work that's goal-oriented. We try to, if there is an adhesion or a point of tension or a strain, something that's giving you structural problems, we do try to correct that. We do try to work where you're sore. So that is true, but it's still always, even though it's very therapeutic work and deep intention, it's still at your own level of comfort. And we do try to, all the therapists try to check in with the client, make sure we're working in a therapeutic level and to get change but not to hurt anybody. But it is deep intention, that's for sure, because we're working toward causal factors. If there's a problem structurally, we're going to try to change that so you can heal the right way and you don't keep re-aggravating the same problem over and over and over. So we will, as a runner, a lot of times, even if you're very symptomatic to just one problem, one spot, we work towards symmetry, so we'll work both sides. We work at looking at mechanical action. Is there something going on with a leg length discrepancy, or a rotation at a joint, or some kind of pattern that's contributing to your wear and tear. And then if we can slowly organize the muscles and align those structures to help that out, then that becomes preventative. So, expect therapeutic work. We're going to try to get in and create change. So it is deeper pressure. At times it's going to have some level of discomfort if you're breaking up adhesions and mobilizing scar tissue. But it's still, ideally each stroke is going to allow us to work a little deeper and get to a more intrinsic level, organize muscles at a deeper level, and just slowly create the opportunity for things to feel a little looser, a little lighter, a little longer, and then that's where that economy of movement comes into play.
So once you've done a session or two, how often do you recommend somebody coming in during, let's say, their preseason lead up? So if you're building your base for an endurance athlete, or say you're a soccer player and you're in your preseason, what would be kind of an ideal time frame to come in?
So some with that, a lot of times clients will do a maintenance routine, whatever that means to them. You know, some people, if they're on a really good flexibility program using the foam roller, keeping their own tissue health there, you know, they maybe need once a month or maybe even less than that. I have other clients that just for maintenance for them, I am their flexibility program, and so they want to come in every week, and that works for them. And then maybe if they truly do have an injury and needs different attention in between, you know, we'll give extra attention besides their maintenance work on what's needed. Do they come in, you know, for inflammatory response or some other injury that's going to hold them back from training, and that's a little more often. But I'd probably say on a maintenance kind of timeline, once a month or twice a month, just enough that you can keep the tissue health, that you can keep that change going, and then we always try to coach people up on things they can do themselves through their own manipulation, their own tissue movement, to take any length we created in a session and make it keep, and maybe even take it a step farther with their own stretching, their own isolated foam roller therapy, any of the mobilities, just to help keep tissue health.
I think we had a nice introduction to what Nate does here at his performance therapy massage. I think next time when we come in, we'll just do some more specific stuff as far as like showing some specific stretches and mobility that runners can do on themselves at the house so that they can go ahead and implement that maintenance program. I want to thank Eric for being a good sport and laying there and not making too much noise as Nate puts that big elbow in there. And again, I want to thank Nate for letting us come in and film this today. If you have any questions, I'll have Nate's contact information on our website, so that way you can get a hold of him, try to make an appointment with him. Now, he's pretty busy, but he does have other therapists that work under him that know his technique, that will do a pretty good job of taking care of you. Again, thank you very much, and this is Bomber Athlete.